Hello there. Today I'm going to discuss why is my cat sneezing. This is video 4 in a 5-video series that discusses common allergies in cats. The standard or core cat vaccines include feline rhinotracheitis, virus, feline panleukopenia, and rabies. Most sneezing cats presented to me are updated with the feline leukemia, virus, and panleukopenia and rabies. And a few of them are feline leukemia and feline immunodeficiency virus positive. Most kittens presented for sneezing are stray cats with no history of vaccines. Feline rhinotracheitis is just inflammation of the nasal passages, that's what rhino stands for, and the trachea. From my own experience, most of the rhinotracheitis cases are triggered by allergies. In unvaccinated kittens, what percentage of cases are triggered by feline rhinotracheitis virus or allergies is unknown to me. Maybe I forgot to put on my stethoscope around my shoulders, right? Feline leukemia virus and feline immunodeficiency virus positive cats are prone to feline rhinotracheitis due to lowered body immunity. In this video, I shall discuss rhinotracheitis as an inflammatory condition triggered by allergies. In cats with rhinotracheitis, the allergens attack the mucous membranes of the nasal passages and the trachea, causing inflammation. Inflamed mucous membranes will swell, produce mucus, become congested, leaden, and with a lot of pain. Severe allergies will break down the capillaries in the nasal passages and sometimes in the trachea, and that will lead to bleeding. Clinical signs of rhinotracheitis. Sneezing is the most characteristic sign of rhinotracheitis. You have clear and copious mucous membranes flowing out of one or both nasal passages. That is sneezing. Sometimes the copious discharge will be tinged with blood. And what is reverse sneezing? There is a cat attempting to swallow the mucus. Snorting, sniffling, gagging. All these words describe the sounds a cat makes while attempting to expel mucus from the trachea. Coughing. This is the sound that a cat makes when attempting to breathe through a very congested trachea and the nasal passages all clogged up with mucus. Severe tracheitis could lead to coughing blood or hemoptysis. A cat will cough when the lungs are congested with mucus too. Allergens are foreign stress agents that lower the body immunity. Low body immunity or compromised homeostasis allows non-pathogenic upper respiratory system bacteria to proliferate and become pathogenic or harmful to the body, to the airways. In other words, untreated allergy-triggered rhinotracheitis will develop secondary bacterial infection. With secondary bacterial infection, you end up with a purulent discharge or pus oozing from one or both nasal passages, and that is a sign of secondary bacterial infection. Sometimes allergies will not discriminate Rhinotracheitis will be accompanied by conjunctivitis with tearing eyes. Treatment for rhinotracheitis. Your veterinarian will determine the best treatment for your cat depending on the severity of the clinical signs. But my treatment plan usually includes an antibiotic injection, an anti-inflammatory injection, usually a steroid. Follow-up medications include liquid antibiotic and anti-inflammatory medication to administer orally at home for 7 days. That's the end of the video. If now you understand why cats sneeze and cough and snort and sniffle, now you know a little bit about your cat, right? Now when you see sneezing, you have a very good idea of what's going on and what you need to do to end the suffering from your cat. If this video was helpful, subscribe, share it, comment, or ask a question below. Thank you for watching and see you in the next video.